Yes. Yes, ma'am. You can. I think we can get started, right? So I'll just quickly go ahead. First of all, before we start, I just want to welcome everyone. Thank you all so much for taking time out of your day and being here. And thank you so much, Chhavi ma'am, for taking time out of the day. I think it's morning for you there, so really appreciate you being here with us today. So before we begin, I'll just quickly introduce Dr. Chhavi. So if you're new here, I'm sure you've at least heard about her. So Dr. Chhavi is our Chief Medical Officer of Sugarfit. She has over 27 years of experience as a physician, and she's been treating patients with chronic lifestyle diseases like diabetes, hypertension, cholesterol for the last couple of years, right, for the last 27 years. So she has been training in the US, and her practice has been in California, and now currently she's in Bangalore. Now, she basically believes in reversing all the lifestyle diseases through a very non-medical approach in order to reduce their complications to all of your vital organs like your heart, kidneys, liver, right? And her 6 steps of daily living, which she will actually be sharing with all of us today, have also been a cornerstone for Sugarfit's approach as well, right? And in this meeting, in their talks with Dr. Chhavi, she will basically answer all your questions, clarify all your doubts, and also show you a path of a glimpse of the path back from diabetes. So also the sessions happens every single Tuesday, right? So please do join in every single Tuesday. And if suppose your answer, your question does not get answered today, you will definitely still benefit from her expertise. And next time you can join in early and put all of your questions on the chat. So Dr. Chhavi, over to you. Is there anything you would like to say before we begin?
Yes, I would say good evening to everyone. And I don't feel I'm anywhere else but with all of you. It's always very good to be at India Talks. And I know Shifa already mentioned that. But a few things about this program. We, for people who have joined the first time, and I see a lot of first-time joiners, Shifa, in the chat. So we do this every Tuesday. The usual time was always 6:30 to 7:30, but because I'm in the US and the time difference is there, I have moved it 1 hour later, and I hope that has not inconvenienced you. If it has, I'm very sorry. The program is about learning, I should say in a nutshell, about your health. I know it is diabetes specific, but diabetes involves the whole body. And the reversal of this chronic lifestyle disease happens when we start looking at our body as a whole, and not that we have one problem and we have to solve that one problem. We have to understand our physical activities role. We have to understand how does our liver metabolize, how does our muscle metabolize, how does various organs of your body react, what happens to the kidneys. So I don't want any more. When people come to my office over the years since I moved to India, the usual discussions are मैंने करेला खा लिया. Nothing wrong with that. मैंने मेथी दाना खा लिया, मैंने कोई आयुर्वेदिक गोली खा ली और बहुत सालों तक the sugar was fine. There are many such discussions which are valuable. I'm not going to, I respect every single thought process. That is something that I have enjoyed over the years. But I don't see the people in India, and I practiced, the reason I'm comparing is because 8, 9 to 10 years, my practice was in the US. They would not talk about physiologic mechanisms. Hamari apni body, our own bodies, we don't understand how they function, what are the various parts, and how healthy should be our muscle, our liver, our various organs, what is the role of fat. And we have to understand that, because without knowing the root cause of all lifestyle disorders, how can we fix it by medication? My question is that. So this program is all about teaching every single person, or educating or sharing what I have learned over the years about lifestyle disorders and how we perceive. I meet people who are brilliant. I mean, I just was in a gathering 2 days back here with lots of my friends who are here and very brilliant. And it was very easily trivialized, Shifa, that, oh, you know what? I know everything. I just stopped my alcohol for last month and I lost 3 kgs. There's no big deal about weight loss or reversal. And And that's very good that you stopped alcohol, but this program or this knowledge base is not based on you stopping just the alcohol. It is about your perception of your day-to-day life. It is your perception of what I can do in my day-to-day life. I cannot say that I did something for 1 month and I didn't do it for the next month, and I'm okay because that month I did it. So I'm not going to go on and on, because this program is a general cover for knowledge of your body, your health, your diabetes, which never happens in a doctor's office in 15 minutes. Even I cannot do it in 15 minutes. So I have extended myself through this 1 hour to every single person, thanks to technology and Zoom, that I could be able to share, whoever wants to listen, is how life has to be lived, how life has to be lived. So we stay away from lifestyle disorders like diabetes, like blood pressure, like obesity. And if we have them, how do we work on day to day, year after year, and come to a beautiful point where we are our best version of ourselves? Not everybody can be a size zero, but what is the best version of ourselves? What constitutes, what is the definition of the best person? All of that. So as Shifa said, please avoid talking about food products here if that's possible, because that's not a nutritional. We have enough community sessions for nutrition. Direct message on, this is my sugar level, what to do. I don't know you as a patient, and it'll be very hard for me to treat you on this forum. This is education. And if you are open to education so that you can change the entire history and trajectory of your chronic disease, you're very welcome. And we would love to share what we know from you all. With that, we'll start with questions. And Shifa, let's start the questions.
Okay, so ma'am, I think the first question is, so they're saying that according to recent studies, the exercises to calf muscle will help reduce sugar levels. Is this myth or true? He got this information from Instagram.
Yeah. So there is a very strong data to support that the calf muscle, which is called soleus, Soleus, if exercised, tends to suck up the blood sugars and help in metabolism much faster. And if you are right after a meal, you sit and you lift your ankles, you are actually working the soleus muscles. It cannot be done for just as they show for a short while. It should be done for a good length of 15 minutes. And if you can put some weight on your thighs while you do it, you're actually exercising the muscle even better. And yes, it is one of the ways by which your postprandial, or right after eating sugars right after meal, do come down. Does it work like a liver? No. Does it work like a pancreas? No. But it utilizes a lot of glucose in your blood to contract that muscle. So after we eat, our sugar levels in our blood are higher if we eat more carb. And if we keep working on the soleus muscle, we may be able to absorb some of that sugar and lower it in the blood. So I would say it helps. It is good for you. And if you can do it, it's great.
So, ma'am, there's another question. Actually, there are two questions, which is very similar, right? So, this is by Miss Vandana, ma'am. So, she's saying that her sugars drop between 12 in the midnight to 3 a.m. and she gets very nervous. And when it goes below 70, 73, and she's also very stressed about this. So, because of the stress, she's unable to sleep. She feels that she might go into hypo, right? So, is there anything that people can do in order to prevent this, or just make sure that this doesn't happen to them?
Shiva, this is a very nice question and a very good question to ask for a bigger platform. Thank you so much for your question. I would like to tell that our body is regulated, every cell in our body is regulated by a biological clock. The biological clock is through the sunrise, daylight, and darkness. Now, our hormones, our secretion of insulin is also a hormone coming out of the pancreas, but various hormones, they all play together depending on the sunlight and the sunset. So in that there is a word called circadian rhythm, and at Sugarfit we talk about it a lot because I do believe that human beings who lose the circadian rhythm, lose their hormonal control, tend to become insulin resistant. It's very important to stay in circadian rhythm. Circadian rhythm can be looked in various aspects. When is your physical activity? When do you wake up? When are your active hours? What time do you eat your food? Do you eat with the daylight and nighttime routines, whatever? And so the question that was asked was at 3 a.m. in the morning. So in the same thing, there is a hormone which is secreted in our body called the cortisol hormone, which is the stress hormone. When that is high, our sugars are high. When that is low, the sugars are low. So according to the circadian rhythm clock, the cortisol levels in our body are lowest at around 3 to 4 p.m. in the afternoon or 3 to 5 p.m. Nobody can have an exact thing, but according to that. And 3 a.m. to 5 a.m. in the morning. And when that is low, our sugar levels fall drastically. Now, and all of us will have that if we were to healthy people who don't have diabetes also, if they were to wear the 24-hour sensor, even for them, we will see that the sugar levels come down around 5 p.m. in the afternoon, 4 p.m. in the afternoon, or 3. Jabki unhone day after day, they might be eating the same food. That shows that you have a circadian rhythm. Your body works beyond food also with the sunlight and hormones. And we have to respect that. We have to respect that we have, as human beings, chosen to eat in darkness, which is terrible for metabolism. We have chosen that we'll eat later and later. We have chosen. No, it's not true that I cannot do it because I have work. This is all something that our mind has created. The day we decide that we're going to eat while daylight is still there, we will turn into wonderful, healthy human beings, every single person. So why do you get hypoglycemic at 3 a.m.? Because the cortisol levels fall down. That's a natural hormonal mechanism. How do we counteract it? So for diabetics, I tell people that there is a mixture powder called Ensure Diabetes, not regular Ensure, because regular Ensure is very high in sugar. Ensure Diabetes. And I will tell that around 10:30 when you're going to bed or 10 o'clock, 2 scoops of that in water. Do not add milk. In water makes a very nice shake. It can be vanilla or chocolate. I would recommend that you take that every night and your 3 a.m. sugars will not come down. I can assure you. And your sugars will not go very high because it is a diabetes specific powder. Another thing I tell people is that talk to your doctor and look at your medications that you are taking at dinner time, pre-dinner, post-dinner. I also ask people to be very careful if they're doing aggressive exercise at night. They have to make it lesser and make the exercise more in the morning time. And what happens, the consequence of what you are saying, ma'am, is very important because agar you're not sleeping well, your entire circadian rhythm gets affected. So this fear, this anxiety that does not let you sleep will cause regular insomnia. And regular insomnia or lack of sleep causes major detriment the next day. So आप चिंता छोड़ दीजिए, forget the worry. You take 2 scoops of Ensure and talk to your coach if you have your coach, because they might give you even seed powder. होता है pumpkin seed, melon seed, in सबका powder. You make a powder of that and you add it to a drink and take it at night. It's a high protein, so उससे भी balanced रहती है sugar at night. So there are many, many ways which we can guarantee you that sugar levels will not fall. Please discuss your medications with your doctor and make sure that but I will never say that eat anything heavy after 7:30 p.m. because that kills the entire other hormones of your body. Your meal has to be, the entire India has to change its habit before 7:30. Agar aapka job is difficult, you take a sandwich with you. But you make sure all of this sitting together at dinner, which is fine. Whoever can do it is very good for your psychology, but not beyond your personal health. So you guys have to find ways by which to eat before 7:30. I rest my case, Shifa. Next question.
So, ma'am, I think this is another question which comes up every single session, right? So they're also saying you've already mentioned this before, but I want to know which magnesium supplement can we take?
No, it's great. I have no problem with that. Please do look at my YouTube video on magnesium and also look at my Instagram video on magnesium. That tells you the physiology and the use of magnesium. मतलब magnesium एक बहुत very very important mineral. I will keep repeating to everybody that we keep talking about calcium, but I feel that the next 100 years will be for magnesium. We got to talk about magnesium and how important magnesium is. And as we get older, we start getting deficient of the absorption of magnesium in the body, and magnesium starts to get lower. Usually, blood mein nahi aata hai, right? Magnesium, just like calcium, when we check in the blood, I'm not very good. I mean, I see women who are completely osteoporotic, their bones are not working, normal calcium in blood. That does not reflect. I mean, even if the normal calcium is there, it's not going in the bone and sitting very clear if you're osteoporotic. So the levels of minerals in blood is, please take it with a pinch of salt. It's not really what is happening in your body. Magnesium is extremely important for every kind of function, bones, teeth, secondary, diabetes, metabolism, muscle cramps, muscle relaxation, calming, great sleep, 100 other benefits of magnesium. So magnesium supplements come in various ways. Your food can be rich of magnesium, but again, you can't guarantee that it's the level of magnesium that needs to be absorbed out of that food group is happening or not. So there are many, many magnesium rich foods that you can please Google and get a list, magnesium rich foods. You can look at them, but you can't quantify them. You cannot make out ki bhai, kitna absorb hua, kitna nahi. So my suggestion would be magnesium glycinate is a good form of taking magnesium. Please don't take it in the oxide form. Take it in the glycinate form. And it is available in various online platforms. Indian brands that I know are, one is called Myocramp and one is called MGD3 with a vitamin D supplement attached to magnesium. So you can use either of these two, or you can order online something called magnesium glycinate. And it's once a day of 500 milligrams.
Got it, ma'am. So we'll move on to the next question, right? So they're asking, I'm checking the fasting sugars regularly, but that sometimes I feel due to checking regularly, I get stressed out and I feel that my fasting sugar rises. So what can be done in this case? Because not checking is also not something that is, recommended.
Yes, absolutely. So I might I would recommend fasting checks. And did we say what his A1C was?
No, ma'am. No.
So Shifa, I don't know. So so yes, your fasting being high is very important to us. And but what I really needed in this question was, what is your A1C? If your A1C is high, then the fasting is reflecting that it's high. So the advantage, I will just say, of doing fasting would be to live in a particular manner on that day, to accountability of your day-to-day life. How much carb you take in the day, what is the quality of the carb you take in, what times do you eat, how much is your portion, how much fiber, salad, and protein will you take in the day, how much exercise will you do. And this will not right away affect next day. So most people, Shifa, think that agle din theek ho jayega. Yeah, 1 week mein theek ho jayega. The body doesn't work like this. If ho jaye, bahut badhiya. But let me tell you that it will take some time. Your metabolism takes time to start getting back into gear. Just because you did something today, you want to see the result tomorrow. Do it for 3 months. And then you tell me, because as your weight comes down, very, very slowly, your metabolic reversals start happening. And what happens is, from that point on, every time. So some people, the way their body works, and God has made us all very different. they might show a reaction right away. But there are people who actually take time, but their consistency, they should not give up because what they're doing is right. So I will tell you that you need to check your fasting. You also need to check your 3-month A1C. You need to make sure that, suppose your fasting is 140, but your 3-month A1C comes down to 6.5. Obviously, there is hypoglycemia in the rest of the day. So then what you need to do is that you stop doing the fasting. We start making you do post meals or randoms, because we really need to know when are you having hypoglycemia, or we'll tell you wear a 14-day sensor. Let us see that definitely if the A1C is 6.5 and your fasting is 140, that does not match. And then we find out, are you having neoglucogenesis? Is it a 3 a.m. hypoglycemia, which is causing the morning rise in sugars? Or is it a Dawn's phenomenon, which I always talk about with hormonal changes when you wake up? Then we give you many ways by which you calm yourself. And as a result of it, the fasting sugars come down. There is a whole science behind this, Shifa. And the most important thing that completes this question is a A1C level along with the fasting sugar, because without that, it's impossible for me to really make sure that this person really has high sugar versus a normal A1C and a higher fasting. So the higher fasting is also coming out of your metabolic machinery's result of what you consumed in the last one day, because it's not just the last meal, it's also in the memory of the last 2 or 3 meals that together gather. So I recommend fasting because it is very conducive to your day. If I'm leaving for work, it's hard for me to do post breakfast or post lunch or post dinner is also okay. But a person who, what I'm trying to create is a habit. And I always write to all of you, whatever you do should be done every single day, and life changes. So giving different times to a patient who's graduating from the program, or it makes me feel that they might not be able to really develop a habit, and the way they do it is fasting creates a habit. जो भी आता है आपके fasting में, and we will find a solution for every single thing. But we do not worry about the fasting too much. And if your fasting is high, then you live that day according to what you have learned will reduce sugar levels. You do not continue to live the day, whatever you do. You really change your ways according to what your fasting levels are. And it really helps you, really become accountable. And I have seen thousands and thousands and thousands of people take care of their diabetes because they did not miss a single day of checking their fasting sugars, whatever that was. Shiva, I hope I was able to answer the question.
All right. Yes, ma'am. So I think we'll move on to the next one. This is really interesting. So they're asking, what is the relevance of waist circumference in diabetes?
You mean waist circumference or
Yes.
weight and
waist.
circumference?
Waist circumference.
So in Sugarfit, we like to also map or take from patients regularly a waist circumference. It's very important for our Indian population because Indian populations have actually, the way we are made, our body mass index is low. It's not very, or moderate, but not very high, like the Western world has very high BMI. But the problem with our Indian population is that if you were to see people from the side, from the front, no, from the back, they will look like, oh my God, they're really slim and small. But the minute they turn on the side, you literally see a paunch. And it's not just men. I think Indian women, as they get a little older in the mid-40s or late 30s, start to also develop a very high waistline. And that is where the whole problem is. That is where our whole country is actually, the whole country is actually, I must say, having chronic lifestyle disorders. So it's very important for us to understand that waist circumference reflects the fat content around the organs of the abdomen, which are very important organs. They are your pancreas, your liver, your kidney, or so visceral fat bola jata hai, or the fat around organs. Waist circumference kam hoti jaye as less as possible is extremely important for us. You might not lose total body weight, but if you're losing inches around your waist, you are definitely working on the fat around the organs, which is not letting the pancreas work, which is not letting the liver work, which is not letting. So it's very important for us. So sometimes patients will not lose weight because we make them develop more muscle, strength training. Muscle is heavier than fat. And when we do that, the person is saying, I'm not losing too much weight as much as I want, but my pants are all getting loose and I'm losing waist circumference. We know that that is going to really, really help you in helping your metabolism. The most important factor it is to reverse your disease. So I think that is what I would say, that is important, and that is why we measure waist, and it is very important. I hope all of you on the program are measuring your waist regularly. There is a video that your coach can send you, exact location of where the waist should be measured every single time and how to do that. And if you don't have that video, please ask your coach, because there's a link we can send you. And that is how we want you to measure your waist circumference. And it is very important for every single person who has diabetes. So please make sure that that waist is measured regularly.
So, ma'am, I think we'll take up the next question. Right? This is by Mr. Ganapati. So he's asking, what is the duration of fasting that you should be following, or, can we do fasting with diabetes?
So again, Mr. Ganapati, it's a very important question. First, we need to know what fasting generates. Okay? So very simple. When we eat food, our pancreas produces insulin so that it can metabolize the sugars or carbohydrate in your food or starch in your food, right? Now, when we don't eat, the pancreas can rest and not make that insulin. The problem of adult onset or type 2 diabetes is that we have too much insulin in our system. Because when we made insulin, it was not working. It's called insulin resistance. And as a result of it, there is an excess insulin that is collected in your blood, and it's causing many problems. So inactive insulin that collects in your blood causes you to further not metabolize, and it causes generation of fat by working on the adipose tissue or fat tissue of the body. So it's very, very important for us to make sure that the insulin levels, which are unnecessarily high in type 2 or adult onset diabetes, come down. So when these levels come down, patient tends to start losing some weight, their metabolisms increase. It's just fabulous. So when you fast, now we'll come to fasting, you start telling the pancreas not to make more insulin because there's no food coming in, and your insulin levels fall. Now this fasting is usually eating windows of 10 to 8 hours, 8 to 10 hours. 8 is better. So you will be fasting for 16 hours and eating for 8 hours. Or you can do 14 hours of fasting, 10 hours of eating. And it should be done under a guided advice of definitely a coach or a nutritionist, because you don't want to overdo it and then have some hypoglycemia. I would recommend people who are on insulin actually not to do it, because insulin has a massive hypoglycemic effect. And people who are taking multiple medicines for diabetes also need to really do it very carefully with their coaches. But I would highly recommend people who are overweight and who are not diabetic or just pre-diabetic, hardly on any medication, to definitely restrict your eating times. So remember, chai bhi nahi, chai with milk is also not allowed. So if you suppose eat dinner at 7 p.m., eating your first meal at 9 a.m., sorry, 11 a.m. would be 16 by 8, which is 16 hours of fasting and 8 hours of eating. Or if you would do 7 p.m. dinner and after 9:30 in the morning, eating your first, whatever, even your almonds or whatever you take, is a 14 by 10 fasting. And this does lower your insulin levels. And when it lowers your insulin levels, pre-diabetes can become much lesser and your weight also comes down. So it's very good for people who are obese or overweight and pre-diabetic to do this. And I think I recommend it. But for people who are on multiple medications for diabetes or people who are taking insulin for diabetes, I would recommend do it extremely careful under guidance. I, on this program, will not recommend them to do intermittent fasting. There are many other ways of intermittent fasting, which I'm not bringing in this program because I believe in a daily habit. I'm a person who thinks that a person who does everything every day is most affected because our bodies work by 12 hours of sunlight and 12 hours of. So this intermittent fasting of 3 days eating and 2 days not eating, I think generates in you not a habit, but an extremism. So I don't really like to bring it, but there are many ways people do it. They'll do weekend fasting, weekdays not fasting. But any fasting will ask your pancreas not to make insulin. So the insulin levels in your body will go down. And as a result of it, your metabolism will improve.
Thank you, ma'am. So there are a couple of questions about like weight loss, weight gain, right? So there are so many people saying that, why does, diabetes cause weight gain, and how can we actually, lose weight with diabetes? And, on the other end of the spectrum, we have people who are, underweight because of diabetes. So how can, people deal with this, this weight issue, ma'am?
So why diabetes does not cause weight gain at all. It's a myth. It is your weight that causes diabetes. It's the opposite. So Shifa, diabetes, I'll make it, underline it 3 times, does not cause weight gain. It is your weight gain that has caused diabetes. Okay, so because we all know that over consuming over calories, eating at the wrong times of the day, circadian rhythms not helping, hormones, lack of sleep, that has all caused insulin resistance with higher insulin levels in the body because of insulin. But the starting point was a poor lifestyle, high insulin levels, weight gain, fatty tissue. So all a cycle. So I would not say that diabetes causes you to gain weight. Insulin causes you to gain weight. Now, why am I saying this, Shifa? Because 16-year-old kids, I see young girls who have PCOS and they don't have diabetes, but they have very, very, very high insulin levels because with affluence, with processed foods in our diet, with inactivity, childhood obesity has become, or adolescent obesity has become a very, very big factor in people's children's lives. And that causes the insulin levels are very, very high and they are way overweight. So, and they don't have diabetes. So just high insulin levels caused from our eating habits, making that pancreas keep making that insulin. That pancreas, poor thing, is fighting. Banai ja raha, it keeps making the insulin because there is so much that's going inside your system that it has to make that insulin. But at a certain point, the cells are dying because they can't make any more insulin. And that insulin goes, diabetes or no diabetes, or a 16-year-old child with PCOS, it keeps multiplying your fat tissue. But it's not diabetes, it is insulin. There's a big factor here. Now, number 2, underweight. Yes, diabetes, which is uncontrolled, or if it is type 1, or if it is LADA or MODI, please get yourself diagnosed, or poorly controlled type 2, puts you in a catabolic state. What is catabolic? Catabolic is the part of metabolism which causes breakdown of healthy tissues, muscle, whatever body mein milta hai, it just keeps breaking down. because body requires energy, and glucose metabolisms are not happening for energy, so it starts breaking your tissues for energy. That's called catabolism. Catabolism causes you to feel really weak, lethargic. You come to me looking very sick, as if you have some disease for a long time, and your sugar levels are 11%, 14%, 13%, very high. Type 1 people also, and the insulin levels are literally, now you're becoming type 1 as type 2. Plus, if you were a type 1 already, you're a Lada Modi, your pancreas is not making any insulin. So the fat tissue will not get generated because insulin causes adiposity or fat tissue multiplication. So you become thinner and leaner. We at Sugarfit have a totally different approach with our management of people who have diabetes. We look at really who you are. We look at many things. We look at your BMI, of course, but we don't end with BMI. We make you do your waist circumference, your hip circumference, and you might be an ideal BMI, but if you have a big belly, we are worried about your visceral adiposity. You might be underweight, you might be, and we have a different intervention. It might be meals, it might be sleep, it might be exercise. For people who fall in that, we try to find out who's in a catabolic state, who is in an anabolic state. Kya chal raha hai body mein before we start putting on. There is no blanket interventions for everybody. Everybody has a customized, individualized, according to the various factors that we see in all of you, and that is how our interventions are generated. So the again, it is not rocket science as people say it, but that's not true. It is a lot of hard work in science, understanding the body, metabolism, health, and to make it an individualized and customized intervention for you. We need to do that for you. So that is what I believe, Shifa, is that don't worry. I know your weight might be low and you're very worried about gaining weight with diabetes, and you may be in some sort of catabolism. We have to assess that. And then we've helped people. Yesterday, actually, I was with a type 1 Shifa who joined our program, a young lady, very smart. And she had joined my program because she was really in a mess. She had been running and she is realizing that for the past 1 year, my sugars are still climbing and I run all day. And she had exhausted herself. Her BMI was 17 when she had come to me, and she said, I don't know what else to do. Why is this sugar? So she was diagnosed type 2 in the society. So I looked at her and she was like 33. She told me last pregnancy happened at 28 and she was still having sugar. And before they discovered in the pregnancy that she was diabetic. She at that point tried to really work at it and made herself even weaker. So I told her to not run at all. And we slowly gave her high protein fiber diet, and we asked her to build up her muscle, which is a complete organ that fights sugar levels if they are very high in your system. And as a result of that, we really made sure that we got her into this. And today, I'm telling you, after about 8 months, her BMI is now 20. She has gained about 4 kgs, which is very big for her. She's a very tiny lady and she feels so energetic. Her sugar levels are superbly good. And she knows that all her life she has to build muscle because that works for her like a pancreas, eating up her sugars. It really helps her. And I diagnosed that she was type 1 and not type 2, and she was wrongly diagnosed as type 2. So I'm grateful to say that after 9 months, she is not on any medications, excellent sugar levels, excellent muscle, weight gain. And if she's on the program, she will know I'm talking about her. But it's excellent to see that people are understanding the bodies at a level that no doctor can explain in 15 minutes. And what happens, you get labeled as type 2 and given wrong medicines, which will not work for you. So I think somewhere weight loss, weight gain, lower weight, higher weight, they all have a role and an understanding, and you don't need to worry about it. And you need to just work with advice, guidance, and you will be better.
That's really nice to hear, ma'am. Thank you so much for that. So there are a lot of questions. I think based on your previous answer, they're asking, how can you identify if type 2 diabetes, if it is due to insulin resistance or due to insufficient insulin production, and also they're asking, is there any test that we can be done to kind of check how much insulin the body is producing?
Um, Absolutely. If you are not taking insulin, very simple, check a fasting insulin level. But if you're taking insulin, that cannot be checked because that will come completely wrong. So if you're on tablets, you can do a fasting insulin level, insulin, not sugar, fasting insulin level, and that will tell the doctor what they need to know about your insulin production. Somebody is also asking difference between types of diabetes. So type 1 is when we don't make insulin at all, okay, and are or very very minute amounts of insulin. The pancreas is not working. It is usually an autoimmune destruction of the beta cells of your pancreas, and is usually seen under the age of 12. But now we are seeing that there's a lot of type 1. It's called LADA or MODY, latent autoimmune diabetes of adult, and MODY, which is mature onset diabetes of the young, and it usually happens in the 20s, mostly in the 20s, but sometimes early 30s. And the doctor has to make the right diagnosis, because if we keep giving you oral medicine with that, it will not work because you don't have the insulin. So how do we check the pancreatic function or the function of your beta cells if you take insulin? We do a test called C-peptide, which is a reflection of the action of your beta cells. How much are your beta cells working? How many are not working? Where you are. Type 2 diabetes who keep their sugar levels extremely high. And this question I would like to address to my whole country. I keep hearing, "Aap jada karte ho control." I've heard that 7.5 is fine. I've heard 8.5 is fine. We make our own guidelines. There is no such thing. It is a standard guideline by the world. Nobody is making any guideline. And the ideal would be to stay 6.5. But really, and below, 6.5 का मतलब ये है कि आपकी शुगर फास्टिंग में लेस देन 100 रहे और खाने के बाद की शुगर लेस देन 140 रहे. Our problem is that we might be 140 fasting and we might be 60 in the evening, which would what is the benefit of that? The glycemic variation within a day has become so much, it's going to hurt your organs. So thoda thoda khate hain, sare din khate hain. Sugar levels don't cross max of 140, don't come less than 90. They stay between this 90, 140, beautiful spot. This is the goal. And how can that happen? When we give work to our pancreas in small amounts. We don't have one time a lot of food and a lot of number for the poor pancreas to process. So we give small food. We have a balance of fiber, protein, thoda sa carb in each meal, and we keep thinking when we eat, how much work can my pancreas do by me eating this carb, that carb, meetha? How can that poor pancreas work? So we have to all start thinking, ki, how much work can I give to my pancreas? Now people who've had diabetes for 15, 20, 25, 30 years, sugar levels above 250, 200 after meal, what have they done? They have slowly made their pancreas work overtime. And as a result of it, those pancreatic cells are destroyed. And at a certain time, they will become type 1. Goliyan kaam nahi karengi because the pancreas is exhausted. The doctors at that time check C-peptide for you and they find out, pancreatic beta cells kaam nahi kar rahi, they're not working. And then they say, sorry, we have to put you on insulin because now we have generated type 1 over time. Because somewhere somebody said, 8% is fine. These doctors in India, they want it too tight. There is no India doctors wanting too tight. This is an international level. It is 6.5 and below. Nobody is making this level. Please open Wikipedia and read it. That has nothing to do with the Indian doctor. That doctor who's saying that they want it tight, they want your good health 20 years from there. But they don't want you to be tight by having 250 in a day. They want you tight by keeping you between 90 and 140 throughout the day. So all the functions, all the organs, everything works fine. And there is a way to do it. And there is always a way to do it. सो एक बार बहुत ज्यादा खा ले, फिर हम कुछ नहीं खाए, फास्टिंग करें, फिर हम 50 पे आ जाए, दैट इज गोइंग टू अफेक्ट योर आईज, your heart, your kidneys. So remember, balance small portions that much that your body can work out, or the body can, pancreas can burn, is the way to go, and eating within the circadian rhythm pattern. And I think I have digressed from the question, but fasting insulin level and C-peptide, which is the beta cell function, I've just explained. People who take insulin cannot do fasting insulin level. They can do their C-peptide level and check your beta cell function.
So I think we can take one last question before we move on to the
We're already
sixth
done?
test.
Okay.
Yeah, it's about 8:20 right now. So I think we'll take one last question. So
Yes.
basically the question is, what is inflammation and how can we reduce it?
Very good question again. Who has asked this question? And I would really like to congratulate them, because they are really with my program and they are trying to really understand the body. So if there's a name there, then, I would.
So I think it's Reshma ma'am.
Okay, very good. Thank you, Reshma. Very good question. And this makes me feel that with me, everybody's trying to learn about their health and body and not the disease. Remember, health and body, that's where we go. So inflammation, $1 million word, a million rupees maybe word, but it's a very important word. It is, अगर इसको हिंदी में बोला जाए तो it is something called सूजन, ठीक है? But let me try to make a picture of the word inflammation in your, and everybody needs to remember this word. So when you get injured, bite हो गया या injury हो गई या आपने itching करी, क्या होता है? Red swelling हो जाती है, उसको हम बोलते हैं अरे स्किन पे इन्फ्लेमेशन हो गया. नॉट इन्फेक्शन, इन्फ्लेमेशन. ओके, इन्फ्लेमेशन बॉडी के अंदर भी होता है. इन्फ्लेमेशन जो आपको नजर नहीं आता, एंड दैट हैपेंस फ्रॉम क्रॉनिक लाइफस्टाइल डिसऑर्डर्स. सो डिसऑर्डर्स लाइक ब्लड प्रेशर, disorders like cholesterol, disorders like COVID or viral infection or any infection. जो आपके थ्रोट में दर्द होता है, वो स्वेलिंग होती है, वो इन्फेक्शन तो है ही, बट वो इन्फेक्शन कर क्या रहा है? इट्स कॉजिंग दैट स्वेलिंग, रेडनेस, राइट? दैट्स इन्फ्लेमेशन. दैट्स अ आउट बाय प्रोडक्ट ऑफ इन्फेक्शन. सो जब आपके हार्ट में ब्लॉक होते हैं, जब हमारी किडनीज ढंग से काम नहीं करती हैं, जब हमारे इनसाइड द बॉडी, क्या फर्स्ट प्रोसेस क्या होता है? बिकॉज ऑफ दीज high sugar levels, high cholesterol levels, blood pressure which is out of control, the poor cells of your body react and they start swelling up. Okay, and then when they're swelling up, they're releasing all kinds of inflammation products into your system, and that leads to a lot of cells dying, collection of dead platelets, और उसके कारण हमारे जो ये कोरोनरी और हार्ट की आर्टरी में ब्लॉक्स बनते हैं, they are also because there is a collection of these inflammatory byproducts on the arterial wall. तो उसके कारण ब्लड फ्लो, चाहे वो लेग्स में है, चाहे वो हार्ट में है, चाहे वो किसी अच्छे ऑर्गन में है, चाहे वो आपकी न्यूरोपैथी के नर्व्स में, every single thing gets affected. There is a blood test to measure your inflammation in the body, and it is called high sensitivity, HSCRP, C-reactive protein, या प्लेन CRP भी कर लीजिए. आप लोगों ने, आई डोंट नो, जिनको भी कोविड हुआ उन्होंने देखा होगा कि डॉक्टर्स वीकली CRP चेक करते थे हर तीसरे दिन, टू सी कि कहाँ था वो इन्फ्लेमेशन फ्रॉम कोविड और कहाँ अब बेटर हो गया इस टाइम. सो वी वर एक्चुअली मेजरिंग कोविड रिकवरी बाय डूइंग CRP. एंड एक टाइफॉइड हो या कोई वायरल इन्फेक्शन, उसमें CRP बहुत बढ़ जाता है. मतलब आई एम टेलिंग यू, द नॉर्मल लिमिट दो तरह से मेजर होता है. तो नॉर्मल लिमिट समझ लीजिए 6 के नीचे ही रहनी चाहिए. कई जो हमारे मेजर्स होते हैं उसमें हम मैक्सिमम 0.3 अलाउ करते हैं, पर वो यूनिट अलग है. इन इन्फेक्शन इट कैन गो अप टू 40, 50, 60, राइट? मैंने 100 भी देखा है. तो आप सोच लीजिए हर सेल बॉडी की इन्फ्लेम्ड है, पर वो उतनी जल्दी फटाफट कम हो जाता है एज एंटीबायोटिक्स आर गिविंग और ट्रीटमेंट इज गिवन और रिकवरी इज हैपनिंग. इन सब चीजों से जो क्रॉनिक लाइफस्टाइल डिसऑर्डर में, उसमें ना ब्रूइंग इन्फ्लेमेशन होता है. तो लेवल बहुत कम, इतना तो नहीं होता, बट this is very different. This is a different kind of inflammation, and it causes damage to the blood flow, which is the most important part of all of us. तो मैं अपना भी करती हूँ yearly CRP, because I just want to see कि क्या मेरी लाइफ में बहुत स्ट्रेस है? Stress can cause it too. Or am I doing enough meditation? Am I relaxing enough? और क्योंकि chronic disease तो नहीं है, but I also want to watch on how I process stress in my body, how I process my sleep. तो CRP आप लोग देखा करें, it's a blood test. Most blood test ranges में होता है, और it's a very important factor to reduce. तो मैंने आपको inflammation समझा दिया, किस टेस्ट से होता है वो भी समझा दिया. Now how to reduce it? तो एक तो नंबर 1, जो भी आपका डिसऑर्डर है, अगर है कोलेस्ट्रॉल, ब्लड प्रेशर, डायबिटीज, उसके लेवल्स नॉर्मल आइए, बिकॉज सबसे जरूरी है कि वो नॉर्मल हो. नंबर 2, अपनी नींद पूरी रखिए. तो नींद को कहते हैं हम स्लीपिंग वेरी uninterrupted between 10 to 2 a.m. is very, very important, but usually 10 to 6, 10 to 5. हर जना, मुझे ये नहीं सुनना कि मैं तो भाई अब मेरी ये एज हो गई, आई स्लीप ओनली 5 hours and I'm fresh. I'm sorry. 7 hours of uninterrupted sleep is very important. And it is also very important that you do not say that at around कि दोपहर को मैं 2 घंटे सो जाऊंगा. That is also not acceptable. Half an hour of nap, 40 minutes in the daytime is very essential for your resting. बट उससे ज्यादा, बल्कि मैं तो कहती हूँ सोफे पे सोइए, ताकि बेड पे गहरी नींद ना आए, कमरे को अंधेरा करके 2 घंटे दोपहर को सो रहे हैं. आई एम सॉरी, दैट इज नॉट गोइंग टू हेल्प योरसेल्व्स. You please need rest during the day. You please should do 40 minutes of resting. But at night, you need to make sure that you get to bed on time, because when you eat at the right time, your entire families, your children, grandchildren, everybody's. I was just reading up on the rate of autism. Autism एक mental disorder होता है young बच्चों को. In Indian children is increasing like anything. And I am telling you that sleep will contribute. I am hearing बच्चे 2 साल के बच्चे रात के 12 बजे तक भाग रहे हैं, सोने नहीं दे रहे हैं. अब आप उनको दिन भर सुलाओगे तो वो रात को कैसे सोएंगे? So it's very important for us also at our age to make sure that we get into a discipline where lights in a house are out by 10:30. We don't need to be. Darkness was meant for rest. It was not meant to be owls. We were not. Otherwise, there are owls around. We don't need to be owls. We are human beings, and we need to understand our bodies. So it's very important that all of us understand that this inflammation can simply be because we haven't slept well, because we have the stress, because we are not putting out time to do meditations. It is very important that all of you sleep very well and watch that inflammation. Do the high sensitivity CRP is even better. You can do plain CRP if you can do, but make sure that that is included in your yearly test, and you're looking at that inflammation and you're asking your doctor questions and you're working towards it. How do I control my primary problem so this inflammation does not? So the beauty of understanding the body is that then we don't need to just say ki a doctor can alone fix it. There are nutritionists, there is fitness instructors, there are yoga instructors, there are people who actually support health, and they are very important in your life. And you start investing in that. You don't need to buy things. People have enough things. Buy your health. Look for those interventions that are telling you that, okay, थोड़ा काम करना पड़ता है, थोड़ा टाइम निकालना पड़ता है, थोड़ी बॉडी को तकलीफ होती है. But no, that is where the focus should be, so that we enjoy whatever God has given us beautifully. It could be families, it could be children, it could be grandchildren, it could be whatever we have financially also. To enjoy all of that, we need health. We really need health. We don't need to be in pain and enjoy it. We need to do it well. So inflammation is a very, very good question, Bhishma. I want to thank you for it, because it is very important that it is an important word. I want people to read about it, to understand. And sorry, Shiva, you can go on to the 6 steps now.
Yes, I'll just quickly share my screen. Hope my screen is visible. Yes. Are you able to see, ma'am?
Yes.
Great.
Mr. Shashikant, I would really request you not to bring your refund or your issues on this program. This is an educative program. and we will have somebody to reach out for you. I really request people not to bring their personal issues on this program. I take out this 1 hour because I want to educate and share. You may belong to Sugarfit, you may not belong to Sugarfit. You're very, very welcome to this program. But all of these operational issues, if they were not mentioned, will take away the sanctity of people's learning on the program. I really appreciate that you joined this program, but please wait for our ops people to reach out to you and not to bring out on a common platform. Thank you. So the 6 steps, I always tell people that if you were to take the 6 steps in your life and make sure that you put it in front of you and always look at it, you will definitely have a benefit. And I don't want to take a lot of time because you know it, but the advantage for you guys to listen to it every time is that you will probably focus on it and work at it. And that is what's going to change your entire life, not just knowing about health, but to know what really can be done every single day simply in our lifestyle that will help us. So we all know that the first step I will always tell you is be accountable. Check your sugars daily, because when you check your sugars daily, you will make sure you live that particular day in a manner which is conducive to your sugar level, and that will change your trajectory entirely of sugar every single day and help you with the sugar levels. The second step is, of course, having salads or eating a bowl of salad before your meal. And every time you eat a bowl of salad 10 minutes before your meal, you will coat your stomach so that the sugar levels are not shooting up right after eating. And as a result of it, it will prevent the absorption of carbs and will help you. So eating salad before food is extremely important for everyone. Step 3, as I talked about, for inflammations, for everything, sleeping well is very, very important. Keep it between 10 to 2, definite sleeping pattern, and then 10 to 5 or 10 to 6 is whatever you want. And make sure that you sleep uninterrupted. Don't drink too much water in the evening. You'll get up all night for going to the restroom. Make sure that all your stress is done. We teach you yoga nidra at Sugarfit. If you are in our program, do the yoga nidra at night time and sleep very well. The next step 4 is about follow your circadian rhythms. So circadian rhythm is the 12-hour cycles. Again, we brought it up in the program. It's every cell of your body recognizes this daylight and day night. So daylight and nighttime, darkness and light. Your body needs to be active during the light, needs to eat during the light, needs to productive work and exercise during the light times. And as the evening progresses or nighttime, let the body rest and get into a sleeping pattern, and your hormones work beautifully. And as a result of it, your sugar levels also look good. So make sure your last meal is before 7:30. Make sure your last meal is early. It's very, very important. The 5th or the 4th step is about exercising. And we again talk about muscle building, muscle building, muscle building. I'll keep saying the word muscle needs to get into every single patient who's come or a person who has come onto my program. If you don't understand muscle, then you will not understand the body. Muscle is done by techniques of exercise, not just walking. Muscles are made by doing therabands, by putting yourself in a plank position. So strength and conditioning causes muscle buildup. There's an isometric way of doing it. And then there is a way of doing weights. And I think every single person at every age group, you can do 1 kg weight, you can do 5 kg weight. Choice is yours, but you got to do weights and you got to do the therabands. And without that, you're not building strength and conditioning. Do planks, do various positions which build up muscle. Walk should be a byproduct. Walk should be anyway 6 to 7,000 steps. Tuk chal nahi chahiye. That is on the side. Please don't call it as exercise. That is a very good way of circulating blood to the body. But building an organ that burns your sugar is muscle. And in Sugarfit, I pay a lot of focus. And I don't think the people that you see in the gym doing 40 kgs, that's not what we're expecting. We are not looking for that. Please don't get disheartened that I cannot do it. It's very simple. We have major videos on our app. We have live instructor. Yesterday, actually, one of my patients was saying that they work with our trainers regularly, and they've developed such beautiful habits of strength and conditioning and muscle, and it's very important. Now, the 6th step is about mindfulness, which is my favorite step, about meditation. Your going inside, your self-reflection, your analysis of who you are and what you're doing will show you the path of what your soul is asking to you to live. It happens silently. You sit there in silence. You might hear mantras, but you need to get out of the hum and drum of life every single day and spend with absolutely nothing for 15 minutes, just the silence. And that brings you that beautiful mindfulness where it makes you step back and look at your plate. It makes you step back and look at an angry situation and say, I don't want to be a part of that situation. It makes you step back and say, oh, I have 50 things at my work that I need to do. And how do I prioritize that I take care of all 50? That kind of an approach where you become people start getting pulled towards you because you give them, you have also got residual energy to give to others. I think meditation has been the one single thing that has taken me through and through life. And I recommend dhyan before everything else. Wonderful to see this survey. I think you guys are doing a great job, Shifa, of getting this survey. I think it's good to look at these answers, and I'm very happy that you're sharing the results. Usually the number of people on the program is 350 or 400. I'm very sorry to see 157 people because I think the time got changed and I think people might not be able to take out that time at this time. But I will again request that more and more people get educated about our body and our health. And whoever you think in your life needs to benefit from it, this is not a Sugarfit venture. This is my own thing. And Shifa helps me from Sugarfit with this. I'm very thankful. But I really want people need to understand their bodies better. So please have families or whoever needs to know about it, understand. Dose of MGD3 is initially I start twice a day. You should not be taking any other D supplement. For about 3 months, I give it twice a day after food. And then after 3 months, I make it one at night regularly.
Thank you so much, ma'am. I think we did take up most of the questions, but I think we did have to kind of, not take all the questions. But I think definitely next Tuesday, do join in everyone at 7:30. We'll definitely take up your questions as well. I think it's going to, I think there were a lot of great questions today, and we kind of, I think catered to a lot of different people. Yes, ma'am.
Shifa, in the survey, could you also ask this question about the time? Because I can always look at the time, right? So you can add it. Would you like it at 6:30 or 7:30? What is the best time for you guys? And I'll make that time available from my day-to-day. It doesn't matter where I am.
Okay, sure, ma'am. I'll definitely do that as well. So I think before the next session, we'll get the time done.
Yes. Yeah. Thank you very much for joining and have a wonderful, sleep and good night and take care.
Yeah. Thank you so much, ma'am. Have a great day ahead.
Yes, I will.
Yeah, thank you so much, everyone, for joining in. Have a great evening. You all can drop off the session now. Thank you so much for joining in.